program to me is very important. If it can save the life of one person like my mom, then it's worth it. We live in the county here in eastern Kentucky where we don't think people care about us. The state doesn't care. The federals don't care. We're just part of these hills. And that's a fact. We don't think anybody cares. But this program, when I come into the health department, I talk to Shirley, and she says, we've got this program for you. And I believe Shirley cares about me. She really does.
Because when we wait for patients to develop symptoms, when we wait for them to be obstructed or start bleeding, that's the time when the cost of treating their cancer is dramatically higher. We're saving lives by doing this project. We're touching lives by doing this project. We're starting to mend relationships between patients, physicians, and the health department and the hospital. It's just overall a win-win situation.
The results of my screening were I had 3 polyps removed, and the results came back that it was not malignant, it was benign.
If this program wouldn't have existed, I don't think I would have been able to get the screening because I couldn't afford it.
We are making a difference, and this program is making a difference. We are seeing a decrease in the amount of colorectal cancer in the state of Kentucky. We are seeing an improvement in overall health care because patients, once they agree to come through the program and they have a good experience, then they're more likely to be willing to undergo further testing if needed, or at least establish a doctor-patient relationship which can subsequently affect their health in a much positive outcome.
The results of my colonoscopy were negative. I do have a condition called diverticulosis, and I'm not in the acute phase, which is diverticulitis, so that's a good thing. No polyps, no malignancies, no blockages, no nothing. I'm clean.
If I hadn't been able to get this screening, I still would not have had a colonoscopy. The polyps that were in there would still be doing whatever they do, and it'd probably be just like my dad and not knowing about it for another 10 years.
The result of my screening was that I had a pre-cancer polyp or mass, that when they took a biopsy of it, it had a high density dysplasia, which is pre-cancer, and it needed to be removed surgically because it was too large to remove any other way. I had to have my colon resection, cut and resectioned.
Because this is what I have decided. It's cheaper to die. This is the truth. You can bury me for less than $4,000 at the funeral home in Martin County. A cheap coffin, put me in the ground, that's it. It's cheaper. I go to the hospital and have this done. I couldn't afford this.
It saved my life. This program has saved my life.